are meeting back our conference committee on S.126, and legislative council has prepared committee of conference report.
Yes. Good afternoon, Jen Carby, Office of Legislative Counsel. Because you are so close for the next one, I just prepared it as a draft committee of conference report. And so the changes from that the Senate is proposing from the last version from the House conferee's proposal are highlighted in yellow. This draft is currently also with the editors. So I'm having them look at it, trying to make good use of time. Okay. So all of the changes that were proposed in the House conferee's report have been accepted, except as you see on here, I think there are really more additions. The first one is just me making this update in several places to the cross-reference in here for the Vermont Steering Committee for Comprehensive Primary Health Care. The next is beyond that is so much is the same. Let's another cross-reference. I think the next one is on the advisory committee. In addition to fixing the cross-reference, we have consulting with, so I put the other members, those 3 members back, and then adding that for the consultation that it will be consulting with and soliciting input from the Health Equity Advisory Commission, physician assistants, adding physical therapists and other healthcare professionals who are not members of the advisory committee, and then the free clinics and VPQHC and others.
Great.
Then date changes incorporated. I added reports to the section heading here, since in this one there are a few reports. There's a suggested addition in the description of the development of the unified health data space, that in addition to decreasing administrative burdens on providers, that it also would be, as a result, increasing efficiency. So this would now say, in order to improve patient and provider access to relevant information, increase efficiencies and decrease administrative burdens on providers, and reduce healthcare system costs. So that is in there in 2 places. Otherwise, no changes. And I think that may be it. That is it. And then all of your signature lines that the editors will be checking. That's it.
What section is the makeup of that board that has
18 members?
Yeah.
Section 9.
I just want to see with my own eyes, because I just got a call. I want to make damn sure that it's.
Yes. So let's see, I'll go back here too. Starts at the very bottom of page 23 on page 24.
23, okay.
And there are, you can see the numbers toward the bottom. Advisory committee should be composed of the following 18 members. And we have
1 representative of advanced practice registered nurses selected by the
just put it back in. Yep.
Practitioners.
And the other one.
We have the
business.
yep. We have the mental health professional from an independent practice, and we have the representative of small businesses.
Yep.
I'm home.
Yeah. So you're good.
It's on. You guys are okay with the efficiency language that we added? Yeah.
I think so, yeah.
Great.
I think it's a good addition, actually.
It's my idea, but I don't care if it's in there or not. There's only one thing I'm asking for.
That's good.
We will, what is that called? This the
Clear
same.
box, that's.
Yeah.
Oh, well, we
Protect.
talked about that in committee, and this,
Yeah.
this is not the time for
Yeah.
that.
Okay. Well,
So
thank you.
All right.
Yay.
Thank you.
Are we all in agreement? Present. Go.
Good. Thank you for your good work.
Thank you. Thank
Thank
you for
you.
your good work. Honestly, thank you for sending us this bill. We worked really hard on it, and
I'm glad.
I,
I'm glad. So did we.
Yeah.
We
Yeah.
worked very hard on it, remembering, it was kind of an idea last year, in April. and then putting together a framework that included really three things. And it's happening, and I think it's really going to be critically important for cost, quality, and access in the state for healthcare. There's just no question about it. It's really great. And the committee, my committee, has worked very hard on this bill, and I appreciate it. I understand that there are things that we can continue to work on. I understand there are things that people may not love about it, but there's time to always time for improvements.
Always.
The best thing about it is, this is going to help our, some of our financially fragile hospitals survive. That may not think that, but it really is.
They may not think that right now.
It
but
is going to be good news, and it's going to be good news for our primary care and prevention. There's a lot of good stuff in here.
There is.
Guys did good work.
There's some hard things in here.
Yeah.
There are.
Yeah. Senator Lyons, you worked very hard on this. I saw you for weeks working on it before it hit the light of day, and it was.
Well, we had that framework forever.
Yeah,
right?
you had really good framework. Yeah.
Okay.
And we started working on this even before crossover.
Yeah.
Knew it was coming, and I hope that what we did honored the work that you did in it.
Yes.
Thank you.
And so, thank you for your good work. Really appreciate it. It's been a good collaborative process all the way through. And we hope that, the folks that we brought in have helped you.
Yeah.
Much.
All right. Oh, thank
I
you.
don't actually have anything for you to
Thank you.
sign yet, because I'm waiting for the edited version, or waiting for the editors to get back to me, but I assume are you all around, or you
Yes.
print off a last page, and if there are no substantive changes, I don't know how you want to do it.
That's
It is.
fine with me.
Yeah,
I mean, I'm
print off the
around
last page.
anyways, but if you want to just print the last page.
Floor time is done.
Yeah.
We have one
Print the
more
last
meeting.
page.
Yeah, if you could,
Let's shake hands.
that'd be
and
great.
We can
I'm,
do this.
So, this is my first conference committee. Is officially, do we shake hands?
Yes.
Oh,
That's the best
yeah. Oh,
part.
that's the best part of it.
Also, the house members,
Do people take pictures? Yes.
traditionally, the house members have baked cakes.
What?
House members just bring cake.
Then we shake hands.
get out of the.
Okay.
Oh, sit down.
Jen, sit down. Oh, come on.
Jen.
And we are still on live, so just I don't really care about what we're.
Picture time.
Patting ourselves on the back.
Who's what?
All right.
Okay, here we go.
Okay, here's the picture.
Oh,
All right, if you want, I'll take a picture when you sign too.
Okay.
If I'm
cool.